Hi, my name is Alyssa Flanders, and I am a certified physician assistant, also known as a PA, here at Scar Center and Appearance Center. And today we're going to be answering some of the most asked questions that we get in clinic and just those from the internet. How can I get rid of my acne scars? Good question, but really it depends what kind of acne scars they are. So there's a lot of different types of acne scars. One type is going to be those pesky raised keloids that people with cystic acne may be getting on their body. Those are usually best treated with things like steroid injections. On the face, though, it's usually more common to have those depressed scars, so those pitted scars, the rolling scars, and for those, it's usually a combination of different things. TCA peels or trichloroacetic acid peels help stimulate collagen to fill in the depressions in the skin. There's also things like microneedling, which does something similar. It's going to cause little micro injury to stimulate collagen production and fill in those depressions. Lasers like CO2 can do something very similar. In terms of redness, there's lasers that focus specifically on redness, like a V-beam laser that can get rid of those dark spots that are left after an acne lesion goes away. Fortunately, though, those tend to go away with time, so you don't always have to do anything for those ones. What makes skincare from a dermatologist different from what I can do at home? Seeing a dermatologist can be really helpful in order to get reliable recommendations. So, of course, we're all on social media, we're all on TikTok, we see all of these really trendy things and products that people are using for their skin, but a lot of that's just really anecdotal and we don't know whether it really works and whether it would really work for you. So seeing a dermatologist, you can get those evidence-based recommendations. You can also start to incorporate prescriptions that, are approved by the FDA, they're safe, they're used for specific indications, and then you can mix that with the things that you want to try on your own, and they can let you know if those are good things to do. I'm so impatient when I start a new skincare routine. I want results tomorrow. How long does it take for a skincare routine to work? So we're definitely all impatient when it comes to skincare. I think we all would love to start a new product or a new prescription and by the weekend have perfect skin, but unfortunately, that's not the reality. The average skin cycle varies by age, but anywhere from 3 weeks to really 3 months. And so it's gonna take time and consistency to see results. I always give an example that even with Accutane, which is now known as isotretinoin, which is probably the most effective thing we have for acne, you really don't see a consistent reduction for 2 to 3 months. And that's one of the most powerful drugs we have. So really, I like patients to be consistent and try something for 2 to 3 months before we assume that it's not working and completely move on to something else. What's the best way to remove blackheads? So best way to remove blackheads, I would say, is to probably actually go to see a dermatologist or to see an esthetician. Generally, we don't like patients to try to remove them themselves because the more that you manipulate things, the more that you're likely to spread infection or possibly even cause scarring. If you're prone to a lot of blackheads and you do want to do something at home, topicals work really well. So active ingredients such as retinols, AHA, BHAs, glycolic acid, salicylic acid, those types of things are good maintenance products. But if you're starting to build up a lot of them and really want them removed, I would recommend seeing a professional for that. When should I apply sunscreen? Do I need it if it is cloudy? Easy answer, all the time. You should have sunscreen every single day, especially I would say the face, commonly missed areas that you should do every day, neck and hands. They're definitely areas that are gonna show both sunburns and premature aging when you skip them. And do I need it if it's cloudy? Yes, you need it every day. If you need it convincing, then check the UV index and you will see that you can still get a lot of UV exposure and you can still get sunburned and all that good stuff even when it's cloudy. What does Botox actually do to my skin? So Botox actually most of the time is an intramuscular injection, so we're not actually targeting the skin, but we're targeting the muscle. And more specifically, we're targeting muscle movement that causes wrinkling in the skin. So we're sort of treating the skin indirectly by treating the muscle. Most common places to get Botox are going to be those upper face areas, so forehead, glabella between the eyebrows, and crow's feet. And when we block the muscle movement, we block those lines that are created as a result of muscle movement. However, there are a few indications for using Botox directly into the skin. One of the more common things in dermatology is treating hyperhidrosis or excessive sweating. So we actually inject Botox into the dermis in the skin, which decreases the sweat gland activity and decreases people's sweating. There's also some recent research that is looking at injecting Botox intradermally to decrease sebaceous or oil gland activity and seeing if that can help with acne and overall oil production in the skin.